Hey, good afternoon, everyone. I'm Mary Brandenburg, Director of Population Health with the Virginia Hospital and Healthcare Association Foundation. Thank you for joining us today for this information session on the Vaccines for Children program. A few housekeeping items. All lines will remain muted throughout the duration of today's webinar. If you have questions for the panelists, please type them in the chat box. We will host a brief Q&A session following the presentation. The slides and recording of today's webinar will be emailed out to all registrants this afternoon. And on behalf of the Virginia Hospital and Healthcare Association, I would like to introduce our colleague from the Virginia Department of Health, Christy Gray, Director, Division of Immunization, Office of Epidemiology, to kick off today's briefing. Christy, I'll turn it over to you.
Thanks so much, Mary. Good afternoon, everybody. Thank you so much for joining us for today's webinar focused on Vaccines for Children program and specifically related to the RSV monoclonal antibody access for children that are eligible for VFC. Next slide. We have both representatives from VDH as well as from Medicaid on this call as well to try to address any questions that you have. Next slide.
Hey, Matt, are you able to advance the slide? We're not seeing those move forward. Thank you.
Great, thank you so much. So again, we're speaking about the VFC program and regarding RSV preventative antibody immunization. Next slide. So the VFC program is a federally funded program that provides vaccine at no cost to children who might otherwise not be able to be vaccinated because of their inability to pay. It is a program established with intent to raise childhood immunization rates in the United States and ensure that there's equal access to vaccines for children. It uses a public-private partnership with the state purchasing the vaccines and providing at no cost to the healthcare provider to administer to the children. And the vaccines are recommended by the Advisory Committee on Immunization Practices, ACIP, for routinely recommended from 0 through 18 years of age. Next slide. So we have just over 700 vaccine for children providers in the state. This is, again, it's a private-public partnership with most of those locations being private practices, about just over 460. We also have federally qualified health centers and rural health centers, local health departments, small amount of pharmacies that we're currently piloting right now, a few hospitals, a few safety net type providers, and free clinics. Next slide. So as I mentioned, children 0 through 18 years of age are eligible to receive VFC vaccines if they are either currently enrolled with Medicaid, they have no health insurance, they're Native American or Alaskan Native, and if they at specifically FQHCs and RHCs underinsured, which usually includes that they have insurance, but it does not cover a specific vaccine. Next slide. So the way that VFC is managed here in Virginia is that the funding is with VFC being an entitlement program, the CMS gets the funding and provides through the CDC to the state health programs. There is a CDC contract in which the states can purchase the vaccines at discount and which they then can distribute out to the private and public health care providers that are enrolled into the VFC program. The amount that you can see on the chart in the bottom of the slide that this is the bulk of the dollars in which we spend on vaccines each year at VDH, and it is the primary source of vaccine purchase by the state, and really aiming to ensure that inability to pay and access are never a reason why a child is not able to be immunized. Next slide. So there are a number of requirements that VOC providers have to follow in order to participate in the program. The first of which is to submit a provider profile, which just identifies the populations that it serves annually. And so this is just ensuring that it makes sense that a provider enrolls into the program, that they are seeing VOC enrolled patients. They also need to screen patients and document the eligibility of each immunization encounter. And so specifically, as we think about birthing hospitals and babies being born in hospitals every day, a known situation is when you might not know what the newborn's eligibility is at the time. So if there are plans in place in which we can make sure that the child receives the immunization, and we work to ensure that stock is addressed and is not the reason why the child is not getting the immunization. So therefore, if there are retrospective, you learn retrospectively what the insurance is. The VFC dose can be replaced if using private stock when you find out later. Next slide. So we need to comply with the ACIP immunization schedule. You need to maintain all records for at least 3 years. You cannot charge additional costs to children when supplied with this public vaccine. You can charge the administration fee or to Medicaid if the child is Medicaid enrolled. You cannot deny administration of the vaccine if they cannot pay the administration fee. For example, if they are uninsured. You need to distribute a vaccine information sheet each time a vaccine is administered. Next slide. And there are storage and handling requirements that we want to make sure that are also need to be followed, including, and this is really intending to make sure that the vaccine that has been provided as part of the program is remaining useful and not wasted. So there are specific, for example, data, digital data loggers to make sure that the refrigerator or freezer, respectively, depending on the vaccine, are being stored and handled at an appropriate temperature. And actions are followed to ensure that if there is an excursion in the temperature, that vaccine is not provided to a patient if it is no longer considered viable. Stock separation of federally FVFC vaccine versus your private stock. It can be in the same fridge unit, but should be separated in, for example, little baskets or just away from each other. Next slide. Obviously, no fraud or abuse as part of the VFC program. There are compliance visits and other educational opportunities to help ensure that your staff are aware of the most up-to-date requirements and recommendations as it relates to vaccine. We want to make sure that it's not just VFC population that is getting vaccinated, so you have to carry your separate stock for any non-VFC eligible population that you do treat. If there is any negligence, the vaccines do need to be replaced, and that you do need to report all doses administered into the Virginia Immunization Information System, which is required for any dose administered in the state starting January 2022 anyway. Next slide. And so really we're talking to you about the Vaccines for Children program because we're really at VDH and with Medicaid very concerned on wanting to make sure that this new preventive antibody Beyfortus or Nirsevimab is available to every child born in your facility during an RSV season without consideration of ability to pay. And so any of those that are not familiar with RSV, it's a very common respiratory virus, usually causing mild symptoms in most people. However, in infants and older adults, it can be very severe. This has been an amazing year for these products, both vaccines and monoclonal antibody to be developed to help protect against these populations against RSV. So it's a really exciting time, but we also need to make sure that we're looking at the logistical and operational components of having to make sure that these products are available to the most vulnerable in Virginia. Next slide. So as I mentioned, Beyfortus was approved by FDA in July, followed by CDC recommendation in August for the prevention of RSV. They have 2 recommendations for 0 to 8 months of age, born during or entering into their first RSV season. All infants are recommended to get this. Secondly, for those that have certain higher risk of severe illness due to RSV, that are 8 to 19 months may be considered for a dose entering into their second season. So in October, the product became available through both acquisition through the private sector as well as through the VFC program. But we are seeing a high demand of this product, which we're excited that the healthcare providers and parents are understanding how helpful this product can be. And so there is a short supply in both private and through the VFC process, and we are now going through allocation where we are filling orders as we're able to through allocation from the CDC. And here's a screenshot of the HAN alert that went out a little earlier this month regarding that, and we're here at VDH providing a clinician letter out shortly to help assist as we're filling in orders as we can and trying to protect the most vulnerable as we're proceeding forward into the RSV season. Next slide. So the case for birthing hospital VFC participation. So as I mentioned at the beginning, only 8 out of approximately 55 birthing hospitals in Virginia are enrolled in the VFC program. And we would really like to ensure every birthing hospital is enrolled in VFC. We want to make sure that this product is available to all of your patients, and it is available through the VFC program. There's a high cost effectiveness of this product for each child, and as we're going into RSV season, which is approximately October to March, it's ideal that babies born during this time frame receive this shot before discharge from the hospital. We know that the rate of Medicaid children seeing their pediatrician or healthcare provider within a week of discharge is much lower than their privately insured counterparts. And we want to make sure that all children do not have to wait to get access to that, to Beyfortus, if we can help it. So therefore, we want all hospitals to be carrying this monoclonal antibody for infants born during the RSV season, and accessible regardless of insurance status. Again, we have our Medicaid colleagues on this call to answer any questions regarding reimbursement. However, because the VFC program exists, birthing hospitals can get Beyfortus through the VFC program, and therefore Medicaid will not be reimbursing privately procured product administered to Medicaid enrolled children. They will be reimbursing administration fee, but not a privately procured product. The product right now is somewhere between $450 and $500 a dose on the private market, and that is much higher than the other immunization that is typically given to this age range, the hepatitis B birth vaccine dose, which is also available through the VFC program if enrolled. However, we understand that is much less in cost, whereas the cost of giving Beyfortus to a child who is Medicaid enrolled would be very large when you can get it for free from the VFC program. So this is really the case for birthing hospitals participating in VFC. Next slide. And so as we're happy to continue on this call to answer any questions you have, but if you are interested in learning more, I've put the link of our Vaccines for Children program on the slide deck, as well as an email if you want to email to learn more or initiate enrollment. These are some screenshots of different products and websites that are on our VFC website to learn about how to the different storage and handling that's recommended. What is the handbook for how to for how the vaccine supply works, and as well as ways to start that pre-enrollment questionnaire. So that's really the slides that we have for you today, and happy to answer any questions or hear any concerns that you all have about participating in the VSC program.
Thank you so much, Christy, for sharing that information. We currently do not have any questions in the chat. As a reminder, please feel free to use the chat if you would like to query Christy or anyone from her team or anyone from DMAS about the Vaccines for Children program or reimbursement related to the administration of the RSV vaccine. And we will be happy to get those answers for you, but no questions right now. Okay, any additional comments from either the DMAS team or the team from the VFC program? Okay, we do have one question.
Oh, I'm sorry. This is Dr. Price Stevens from DMAS. Hello.
No, that's fine. Please go ahead. And then we've got one question in the chat. I'll continue to collect those while you're speaking, Dr. Price.
Wonderful. We just want to thank you, VDH, and also VHHA for this webinar and such an important topic. When we look at the experience that DMAS had last year during RSV season, and looking at our children under 5, we had over 8,000 cases in the state of Virginia of Medicaid children with RSV who sought care either at an emergency room or at a hospital. Unfortunately, had 4 deaths due to RSV. Now, this is not all of the children and not all the children under 5 who possibly had RSV, but in this age range, which we're talking about in terms of the Beyfortus antibody, this is a group that is vulnerable and that we know that hit us hard last year. So we just want to encourage all birthing centers, pediatricians, providers to really consider taking advantage of the Vaccine for Children's program, and just want to give our stamp of support and appreciation.
Thank you, Dr. Price Stevens. We do have a few questions that have come up. So one is, just to clarify, Vaccines for Children only covers the RSV vaccine if the patient has Medicaid?
Hey, Mary. Matthew, do you want to, I'm not sure if it'd be easier to go back to the slides. No, so VSC vaccine is for children 0 through 18 years of age that are Medicaid enrolled, uninsured, thank you, that's great, Native American or Alaskan Native, or at FQHC, RHCs are underinsured. So I think the question is if RSV is only covered if the patient has Medicaid, and no, if the child does not have insurance, you can also give VFC vaccine to the child, or if the child is Native American or Alaskan Native. In the birthing hospitals, those would be the 3 that would apply. So really, I think primarily we're looking at uninsured or Medicaid enrolled. And happy to,
Thanks so
if
much,
that,
Christy.
sure.
Yeah, I think that answered that question. Another question that came up, is there any reimbursement to vaccinate women gestational age 32 to 36 weeks?
Yeah, so thanks so much for bringing that up. So if mom is vaccinated using the RSV vaccine, then baby is no longer recommended to get the monoclonal antibody at birth. So that is definitely a consideration that birthing hospitals should be taking into account and checking of mom's vaccine status. Right now, the vaccine for RSV is not yet on the CDC contract. We're expecting that to occur sometime in January. And once it is, however, a mother who is who is 18 years of age or younger would be able to get the RSV vaccine if they are VFC eligible, so Medicaid enrolled or has no insurance, Native American, Alaskan Native, or underinsured at an FQHC, RHC. But right now the product yet isn't on the CDC contract, so we cannot provide it out yet, but it is expected to be able to be available in the first quarter of 2024.
Thank you. Another question, does VDH provide the data loggers for temperature monitoring?
VDH can provide the data loggers for temperature monitoring if that is needed.
All right, thank you. Yeah. And the last question I see, at least for now, is could you please repeat what you said about Beyfortus offerings if the patient is Medicaid eligible or covered and the hospital is a VFC participating hospital? Is it not covered in the outpatient setting?
Sure. So Beyfortus is covered if you are a VFC provider, whether birthing hospital or outpatient setting. So if the child goes to their pediatrician, a few days after discharge, they can get Beyfortus at their pediatrician's office if they're VFC enrolled. What we're trying to meet here is that the optimal time if a baby is born during the RSV season is that the baby receive it before discharge from the hospital, because at least Medicaid enrolled children don't often visit the healthcare provider in as timely a fashion as we'd like for them to be able to have had access and started access to that monoclonal antibody.
Okay, thank you. I don't see any other questions that have come up. Hold on a moment. Okay, so I do have one. It says, but if they are Medicaid insured and we are not a participating hospital, then we cannot be reimbursed by the VFC?
If they're Medicaid insured and we're not a participating hospital, then we cannot be reimbursed. So VFC provides the actual vaccine product or the immunization products. So for example, for Beyfortus or hepatitis B vaccine for a birthing hospital, you would order those products from us and we would ship you the products if you are enrolled, and you would use those products on the patient and then bill Medicaid for the administration fee of the product. If, however, you procure those products through your private means and do not get the products from VFC, Medicaid will not reimburse the cost of you privately purchasing those products.
Okay, thank you. Any other questions or clarifying points from our attendees that I could share with the teams? We'll give you just a moment.
And while we're waiting for that, just want to thanks so much, Matthew, for going back to this enrollment and resources page. Again, that email address right there will link you directly to our VSC team, and they can answer any other questions you have when you get off. Sometimes webinars you get off and you're like, oh, I forgot I had that one question. Please feel free to reach out to us, and we're happy to continue having a dialogue with each of you. We really want to try to make sure that to close any knowledge gap that might exist of the existence of the VFC program and how helpful it can be to reduce costs to you for procuring these products to make sure that all your patients have access to these immunizations.
All right, and we do have a question that just came in. How do you recommend inpatient birthing hospitals stock and track Beyfortus, particularly thinking about keeping the stocks separate, right? VFC versus private stock for eligible patients.
Sure. So I think I would really recommend you contact us to speak maybe more directly about your particular setup. You can keep the products in the same unit. However, we've seen little baskets that they're separated in, and I'm not sure, Beth, Krista, you want to get off the line and mention something, but I do recommend that you talk to us and we can discuss a little bit more your specific scenario.
All right, thank you so much. And I understand there was a recent Medicaid bulletin regarding RSV. Does anyone from the DMAS team want to just point to that or let folks know where it can be found?
Thank you. You did. We appreciate that. So at our DMAS site, www.dmas.virginia.gov, there are Medicaid bulletins. We had one released on 10/30 regarding coverage of the RSV vaccination and preventative treatment. So we would encourage all providers to please go and check out that bulletin, and it also has information if you have further questions. Thank you.
Thank you so much. We appreciate you sharing that resource. And I do not see any other questions or comments in the chat. So let's, I just want to say thank you so much to Christy, the team at VDH, the Vaccines for Children program, and the team at DMAS for sharing this information with our members. We hope it's been an informative session for you. As always, feel free to reach out if you have any questions. We will be sending out the recording and materials after we wrap up this afternoon. And otherwise, just I hope you have a wonderful day. And thanks so much.
Thank you.